right, cool. Yeah, let's get started. This is the June 17th edition of Tech for Dreaming. So we did our settling in part of the agenda here. Per usual, I'm going to give an overview of, what is this community, what is Tech for Dreaming, and the main topic will be devices to induce and stabilize lucid dreams. So I'll do an overview of the past activity in the space and then kind of the current state. And then a lot of the time will be spent in discussion amongst ourselves, less of me talking, and hopefully hearing from some of the people actually building in the space about what they're working on and getting a good discussion with the group here. As mentioned, this event will be recorded, and this is so we can share it on the YouTube channel so people that can't join in real time can check it out later. And yeah, we have the raise hand function if you want to mention anything at any time, go for it. Also, the chat is open if you want to just keep an ongoing chat. That's good with me. All right. I'll do a quick intro. I think most people know me, but not everybody. So yeah, I started Tech for Dreaming in 2021. I've been lucid dreaming for over a decade. Since then, I've had not thousands, hundreds of lucid dreams, some of them pretty profound, which was motivating for me to start this community, which was now over 5 years ago. Somehow time is flying by. I have a background in wearables technology, so I've worked at a variety of wearables company, including Aura and Fitbit and Medtronic, and a bit of dream tech work experience, which is pretty rare at Dust, which we were talking about previously. No longer there, so I'm a free agent and agnostic to whatever technologies are being developed in the space now. Background in engineering and business, and yeah, started this because I think lucid dreaming has so much potential, but it's difficult for people to access that state. So I feel motivated to help bring forward the skillful use of technology to enable more people to be able to access that state. So back in the day, about 5 years ago, I was surprised there wasn't any kind of group that hit on the overlap between science, technology, and lucid dreaming, at least not from kind of the grassroots tinkerer, builder kind of space. So decided to form this group. I live in San Francisco with my son, Connor, who's now getting much bigger. For some of you that have been in previous events, he was a little baby when we first started. And now he just turned 6 last week, which again, time flies. So this is my Tech for Dreaming overview. It's a community focused on the application of technology to make lucid dreaming more accessible. So we're focused on things like devices and supplements and mobile applications. Today, we're going to be focusing primarily on devices. So think of systems of sensors and stimulation modalities to increase the probability of getting people into the lucid dreaming state each night. We're less focused on the cognitive techniques. So things like dream journaling, daytime reality checks, less focused on dream sharing. Those are covered well in other groups, so really want to keep this group focused on that kind of intersection of science and lucid dreaming as much as possible. And yeah, I want this to be a hub for learning and collaborating and experimenting together, so a place where we can share information about whether it's the most recent dream research study or an article about lucid dreaming, a place to share information, a place to work together too. Several people are building in the community, and there's people with good skill sets. So along the way, playing matchmaker between people with projects and people looking to work on projects. So collaborating together and also experimenting together, being quick to try the latest technology in the space, even if it's in the prototype stage in a safe way. But yeah, a way to experiment together and kind of share our direct experiences from those experimentations. You can find us on some of the social channels. The most kind of active real-time discussions are on the Discord server, which I can drop a link to that in the chat a little bit later, or somebody could drop it now if they have it handy. Future events, I'm going to start posting on Luma now. Previously, we had done Eventbrite, but for a few reasons, I'm switching over to Luma. It seems like it worked all right for this one. You can always check out the Tech for Dreaming website for future events and also past events, which we post on our YouTube channel. All right, that's my overview. Any initial questions on just kind of the community overall before I get into a overview of the devices space, or anything that I didn't say that people think are important to say? All right, I will continue forward. And as mentioned at the onset, I'm going to give an overview. I expect I'm going to do less of the talking after a few minutes of doing this overview, but I want to make sure we have a common foundation on what we're talking about here, just to kind of set the table for the discussion. So I got a few slides to talk about devices and yeah, just kind of set the stage here. So lucid dreaming, one concise definition of that is realizing that you're dreaming while you're dreaming. You know, it's not necessarily about control. It's more about that realization that you're dreaming in the dream. It's not new. It's been around for thousands of years. Notably, the Tibetans have been doing it with dream yoga practices, and others have been doing it for a long time. So nothing new. What's kind of new is the scientific understanding of it and people believing that it's real. So it hasn't really gone that mainstream until it was scientifically proven, first by Keith Hearn in 1975, and then confirmed by Stephen LaBerge in the early 80s. And that's really when that kind of science and technology part started to sprout up, when it could be scientifically quantified and proven through these kind of preordained eye movements when somebody became lucid in a dream. So that's really when kind of the science perspective took off in the lucid dreaming space in the 70s and early 80s. And then, question people have sometimes is why lucid dream? I think there's a variety of reasons. And for one person, it could be multiple reasons on any given night. Things like understanding your psyche, psychological understanding, psychological healing, creativity, problem solving. It's kind of this way to communicate with your subconscious mind in a way. Nightmare relief, especially for those reoccurring nightmares that some people have. You can work with nightmares in the lucid dreaming space in a different way. Some people like to rehearse skills in lucid dreams, or do spiritual development or explorations, or just pure entertainment if you want to fly around or whatever else you want to do in a dream. Sometimes that's possible. So a lot of reasons that people may want to lucid dream, which kind of begs the question, like, why hasn't it really taken off yet? I think one of the primary reasons is it's hard to get into that state, especially for people that don't have the natural aptitude for lucid dreaming. And I think it's something like 50% of people have one lucid dream in their lifetime, and that percentage goes down. People that have lucid dreams on a monthly basis or on a weekly basis, it's not a very common state for people to get into. And there's these techniques, the cognitive techniques like dream journaling and a variety of others that help, but they can only really take us so far, I think. And that, to me, opens up an opportunity where we can make this state that I think is profound more accessible to more people. Got a few more slides here before I open it up. So yeah, I mentioned the quote unquote cognitive techniques. I don't think any technology is a replacement for the cognitive techniques. And I picture that as kind of the foundation, if you view it as kind of this bottom of a pyramid thing, where it's really the fundamentals of lucid dreaming, things like being able to remember your dreams and keeping a dream journal to help your dream recall, doing things like understanding your recurring dream signs, and doing a variety of the nighttime practices, like wake back to bed, and setting a strong intention to lucid dream as you're falling asleep. There's a variety of techniques that really serve as the foundation in mindfulness practices. But I do think there is a place for external substances and external devices to jumpstart a practice. And thinking of it as a way to give people a taste of that lucid dreaming experience, which can then motivate them to go deeper into the cognitive techniques, but then once in a while also, want to opt into having a lucid dreaming experience, be more likely on any given night. So yeah, today we're going to talk primarily about more of the external, kind of stimuli, so devices with sensors and, different stimulation techniques. I have an overview of like some of the sensors and stim techniques. Not looking to go line by line on these. It's just kind of like a menu of, in a device, here are some of the sensors that people are using. So things like optical sensing or PPG. So it's measuring the volumetric changes in blood circulation. And from that, you can derive a variety of things like heart rate variability, respiratory rate, blood oxygen levels. EEGs are pretty popular for measuring brain activity. There's fNIRS for measuring changes in blood oxygenation. It's kind of a proxy for neural activity. I know the BIA team is working on. Movement sensors, a variety of other sensors that can help to better time the stimulation, quantify the stimulation, and then find like the sweet spot for what kind of stimulation could work to induce lucidity. Variety of different options for stimulation too. So light and sounds, vibrational sensations or haptics, electrical stim. One of the newer things that's being used in the lucid dreaming space is targeted focus ultrasounds, which I'm sure we'll talk about more. There's a company Prophetic working on that specifically. And there's a variety of other techniques that are possible to put into a lucid dreaming device. So here's my cute AI slop image of a lucid dreaming device graveyard here. So there's been, people over the last 40 years that have been developing devices, starting with Nova Dreamer, the Stephen LaBerge Lucidity Institute kicked it off. One of our active community members, Craig Webb, was one of the developers there. He's at IASD right now, along with a few other people, so he couldn't make it. But like this device space has gone back for a while, but nothing's really resonated. Nothing's totally worked. There was this Aurora device that had a Kickstarter in 2013. They raised about $250,000. Good demonstration of demands, but the device, didn't pan out. There's been a variety of devices too, so it's really, up to any new entrant into this market, the lucid dreaming device field, to explain, why their approach is different and why this time is different. And then reasons why some of the past products have struggled. This is not a comprehensive list, but I think these are some of the highlights on what, why the previous devices haven't really worked. So the detection of REM and even the subset of REM, where there's like the most susceptible sweet spot for a lucidity cue, hasn't really been that accurate, at least not in real time, which is pretty essential for this application. And then the stimulation can wake a person up instead of inducing lucidity, which is obviously frustrating for a person if they don't want their sleep disrupted. And along that line, previous devices, could have been more comfortable. When you think of a mask or a headband, one of the immediate concerns people have is, is it comfortable to sleep with? And some of the previous devices have not been that comfortable. And all these things, are all kind of detractors, and there wasn't a good enough benefit to outweigh those as far as the actual efficacy of the device to reliably induce a lucid dream. I think some of these devices induce lucid dreams sporadically at best for some people, but there's no device that really, reliably induce lucid dreams for a broad audience. If there was, then that could maybe overcome some of these discomfort and sleep quality issues, but I don't think there's been that kind of equation that's been balanced between the benefits and the downsides of the device to date. And then I think, this is my last slide before I open it up. I know I've been talking for a while. And again, setting the common foundation here. These are some of the upcoming devices for lucid dreaming. So we got sleep masks from REMspace, headbands from Prophetic, and that's lucid dreaming is their primary, or at least one of their primary use cases. And there's a few devices that are more focused on improving sleep quality, and then have lucid dreaming as an additional kind of add-on feature, or add-on benefit. So there's, BIA is one, which I know we have some of the team there. And then we got Michael from REMspace, which is awesome too. And one that I heard of recently was gamma wave technologies. So I put that on the list too. But they're in kind of earlier stage Kickstarter phase. So this is a very high level snapshot. As we get into the discussion here, we can definitely go deeper on any of these particular devices. And, also it'd be great to get into some of the projects that are being actively developed by people that are active in this community too. I'm thinking Dr. Ken, I see he's on the line too. So hopefully he can talk about DreamDirector AI at some point today and tell us the latest progress on that. I know, Michael has been working on InSpec. He's not able to join today. Different Michael, the I am coder guy in the Discord server. He's developing, something around a bedside kind of night vision camera. This is a very broad overview to start. Again, we can get into any of these individually. And I have an outline of here's some things that we can talk about. View this as it's a menu of options that we can totally go off menu if people want to talk about something different. But I'm thinking we can have at least some kind of description of progress on devices or projects from people building in the space would be great. Whoever's willing to talk around that. We can talk a bit more about like why previous efforts haven't worked out. We can talk about like what would it take for a device to be successful, like where are the gaps and how do we fill those gaps. And then more of a broad question, like should we actually be developing technology to make lucid dreaming more accessible? So kind of like the broader philosophical, like should we even be doing this kind of discussion could be interesting. And then perhaps at the end, we could even talk about like who's working on projects and who would benefit from other people's help, and people that want to help and join projects. We can do some of that matchmaking at the end, depending on how the conversation flows. All right, so any questions or thoughts on anything I said before we go forward? All right, nice. Anybody keen to share about any of their projects they've been working on to give kind of an update on like things they're working on? Dr. Ken, you had mentioned you're down to share a bit about progress on DreamDirector. I see Michael here too. You're not obligated to share anything about Lucid Me Pro, but you're totally welcome to share anything if you want to get some thoughts from people here. I know we got people from BIA that are also here, which they're developing or at least conceiving of a lucid dreaming feature. So feel free to share as much or as little as you want about that. Andrew and team. So yeah, just want to open it up. I see Michael's hands up, so I'll go to Michael first.
Mm-hmm. First of all, Brian, thank you for introduction. As you mentioned, we have a lot of problems, not just with the idea of lucid dreaming. I mean, we still struggle understanding how it actually happens, but also it's about reliability of those devices, technology, how it is comfortable to use, and so on and so on. And for example, in our case, we're still refining our tech, but because our goal is to create very reliable, multifunctional platform for different types of lucid dreaming stimulations, techniques, methods, and at the same time, the same platform could be used for different goals. And by the way, last week we had started testing the mask on people with sleep-related problems, so far successfully, because in comparison with lucid dreaming, it looks much more easier to achieve, because we used to work on lucid dreaming, which is a very difficult topic, and once you switch on something else sleep related, it feels and looks much easier. And because we have developed the platform in general, we need just a few weeks, maybe a couple of months to refine it, but the platform itself is suitable to test on people with sleep related problems. So we have started testing it. And I think that regarding lucid dreaming, I think you have mentioned that some devices wake people instead of waking them in their dreams. But I would say it's not such a big problem, because in reality, and I will stand on my ground, lucid dreaming techniques induced upon awakenings could be sometimes even easier than it could look even easier than become conscious while dreaming. And for example, when we were conducting studies back then in my laboratory in Russia, now if somebody don't know, I live in the United States, but back then I had a very active laboratory in Russia, and we were conducting a lot of studies in our laboratory, and we were sending cues during REM sleep. But if the participants of our studies were waking up during REM sleep, it was not a big problem, because they were using specific techniques to reinduce REM sleep and keeping their consciousness with them. So we didn't lose much by waking people in our laboratory, and I'm pretty sure that lucid dreaming devices could use this feature as well. The only problem is that to use this sweet spot between periods of REM sleep, you need to know some specific techniques. You need to know some specific actions, and you have to be trained to know what to do. This is the only problem. And in this case, I agree with you that to do something viral, well-known, you need something that does not require any instructions, any knowledge, any reading books. But I'm pretty sure that it's this or next year, it may be the case. And I hope REMspace or other startups and companies or some talented engineers or scientists will develop something, because we have neural models, AI, we have more and more advanced tech. And for example, just one last thing, in our company, we have a team, an AI team. So a team of AI engineers who develop different neural models, including with different purposes, including lucid dreaming.
Right. Yeah. That makes sense. All good points. And I feel like, maybe there's these intermediate steps before we get to this on-demand lucid dreaming without any kind of training. I'm thinking of, like if you apply targeted lucidity reactivation, or TLR for short, in that form factor of a, in a device, it takes some training, but you can at least get some efficacy that's more feasible in the near term to employ, without having to get the targeting totally right and personalized. There's a lot you need to do to get this kind of lucid dreaming on demand to actually be feasible. So I'm thinking like maybe the most effective near-term thing is kind of this thing that requires training, which limits the virality or how quickly it can grow, but at least gets above this bar of effectiveness, which is maybe a good segue to like Dr. Ken, because I know you're working on like effectively kind of TLR, targeted lucidity reactivation, with the Apple Watch, right?
Yeah.
Maybe we can like bounce around a little bit and talk about a few different projects.
Yeah. Well, it's great to hear from Michael and what he's doing. And I can totally relate to also, once you build a tech stack, it can be applied to other problems in sleep that have bigger markets, and maybe are not as hard as lucid dreaming is. And certainly, we're developing in the Apple Watch, iPhone tech stack. And we've had a product in market for a year now, and it's called DreamDirector, and it's on the App Store. And then I'm a prof at Acadia University, a prof in psychology. And so last year we did a study with 25 participants using the app for 25 nights. And then this year we did 19 participants using the app for 22 nights. And you've mentioned, so the good news with the R tech is it's built on technology that users already have. So people already own Apple Watches. There's 120 million Apple Watches. So there's no need to buy a device. Like you might already have it. And also, you mentioned personalization. So the way, like, again, yes, it would be great to get to the lucid dream on demand, and that is the hope, right, or the goal. And as we continue to enhance models and continue to improve, like add sensors, etc., the field will get there. So we're at the very early stages of something that is going to just keep getting better and better. And then with our system, the way it works is you basically train it for 4 to 8 nights. So in our studies, we had psychology students who brought their own Apple Watches. They wore it to bed for 4 to 8 nights, and then it builds a model for them. And just about everyone got a model, but we had one of the 19 didn't get a model, and is probably something to do with their setup. I'm actually now working on, so the version we have in play right now is version 2.3, but I've been working on version 3.0, vibe coding some of it to solve a whole bunch of user friction issues, right? Like there's the older version, it was, like to know that you have to build a model, and then, you got to make sure you got your settings right. So I've added a dashboard, and I've got a few people on this group who are beta testers. And so we have been beta testing the 3.0, and it's got a, it's got a dashboard on it. Like I can pull it up. And so I guess one other thing I want to just mention is with the last study, what I find is, okay, again, with our model accuracy, or our hit rate is 50%, which does not sound great. I mean, that sounds like chance, but if you look at the hypnograms, it's not, you can see that it is hitting the REM sleep half the time, but it does look targeted. And we have now got a new model, what's called a transfer learning model, that will speed up personalized models, and I'm hoping will give us more, better accuracy. So there's that in play. And then the other thing we've really been working on.
Dr. Ken, I made you a co-presenter. If you did want to share something, it sounded like you might want to share something. So you're
I was trying to pull up a deck here, but I seem to be having, oh wait, maybe here's something. Okay, let me go like this. If I go, I'll just show you. I mean,
a good way to start would be, if you can give an overview of this, and then as much as like Michael's willing to share about Lucid Me Pro and kind of the transition from Lucid Me Mask to Lucid Me Pro and kind of like what's different, I think could be interesting for people. And also I'm interested in that pivot on improving sleep quality too. I think that could also have some good overlap with the BIA team and Andrew and them, which I think they're mostly hanging out in the background, but they're willing to share a little bit about the BIA sleep mask and what they're working on. Because they're also focused on sleep quality as kind of like the initial feature, and then lucid dreaming as an additional add-on functionality. So there could be some good like interplay between like BIA and REMspace. And anyways, I feel like there's a good sampling of things we can hit up, but definitely want to hear if you can.
I'll just say I have some skepticism about our ability to use technology to enhance sleep. So I'll just say that. But that said, I do also have a prototype of a rocking bed. And I think there's also things that can be done to help people with sleep hygiene. Certain people, they sleep with a fan, etc. They're already using technology to help them enhance their sleep. And there's sleep disorders too, right? So not only nightmares, REM sleep behavior disorders, one that I've been developing for, also helping people with delayed sleep phase disorder. So I've got some, I would call them prototype apps in the works for some of those. I would call them, parasomnias or, digital therapeutics. But the thing is, if you have to get FDA approval, it becomes much more involved. So that's, a caveat about that. Let me see if I can share my screen. How do I do that here?
In the bottom navigation menu in the middle, like the square with the up arrow.
Okay, it says you're not allowed to share your screen.
I added you as a co-presenter.
Let
me double check that on my end.
Been having a few technical issues here.
Yeah, all good if you can't share it. It looks like you are listed as a co-presenter here.
Yeah, and just let me just see full screen. Yeah, it's not letting me do it. Although I see this deck here. What is that? Oh, that says Tech for Dreaming. Yeah. Well,
okay.
I think one of the main things I want to talk about just is what we're learning. So one is I feel like we've basically made good progress on REM targeting. So that's largely solved and is going to continue to get better. But you mentioned waking people up, right? And so what we did this last study is we've been experimenting with different things like light flashes and sounds and watch vibration. And what, we've been finding is, or what I've been experimenting with is, okay, making the volume louder or increasing in intensity or having the intensity increase and decrease. And then also making sure the stimuli are patterned in a non-periodic way. So our brain, when we're sleeping, there is a part of our brain that's paying attention to the environment, and it's paying attention if there's a problem, right? To wake you up, right? And so you're trying to thread the needle where you're trying to get a stimuli that is strong enough to be perceived and incorporated, but not so strong to wake the person up. So anyways, I think what's been happening now, we've done our second pass on this. It does seem like we have had more success with non-periodic stimuli, right? So you've got it, because periodic stuff gets sort of filtered out. And then also stuff where you're changing the intensity.
Can you describe periodic and non-periodic just briefly?
So for example, we did a stimuli our first year where it was like, okay, we're going to flash light, wait 5 seconds, flash it, and then, wait 5 seconds, flash it. Now I would say you should flash it, go 3 seconds, flash it, wait 5 seconds, flash it, go 2 seconds. So it's stagger. And I think that increases the information content and makes it seem like it's a signal. And I think that helps it incorporate at a higher rate. So anyway, that's something we've been playing with. And then the other thing we've noticed is some of our participants, it just works. So we had like 1 or 2 participants where, here, I'll just read you some of the accounts. Like one we had flashing lights was one of the stimuli. I had a dream that I was in a music video for the song Flashing Lights by Kanye West, and it was like in an alternate world and sort of just floating around in space with bright colors and flashing lights whenever the song said flashing lights. So this is another thing about dream incorporation, is it gets incorporated in surprising ways, maybe not, the way you might expect, right?
Yeah. I was looking at Dash. I think she had a dream about getting arrested one time with flashing lights.
With flashing lights. Yeah, it's like the cop car.
Yeah.
We had another stimuli where I repeated, this is a lucid dream. We had white noise. So here's another trick, which is to have white noise going. And what that does is it prepares the auditory system to a certain level of noise, and then you can have the voice come in, get louder and louder and softer. It creates a very spooky effect. It's almost like, when you're watching white noise and like an image comes out of the white noise, like white noise, like so on TV, and an image came out. It has that experience where it seems like the voice comes out. So anyway, we've been experimenting with that, and this is different than if you're in silence and then you start playing a sound. It's like, okay, something's going on, time to wake up, right? So again, I would say this last iteration, there's been a bunch of learnings about how to adjust the stimuli to basically thread the needle. So here's one where we have the voice, my voice being
real quick too. I want to maybe kind of maybe put any researchers on the call too, if there's any lessons from the sleep laboratory that they think are relevant. I think that would be a super interesting input into the conversation about in the sleep lab, how you might kind of play with the stimulation, techniques, whether it's real-time brain wipe, monitoring the sensor data and then employing some specific kind of stimulation technique would be interesting. Didn't mean to cut you off, Ken, but I want to at least.
No. I mean, you make a great point. And Michael's got his hand up. I'm curious to hear what he's got to say.
Oh yeah. Yeah. Go ahead, Michael.
Yeah, believe me, we have tried so many things, and you have mentioned that one of the problems. I mean, Brian, you have mentioned that one of the problems is proper REM sleep detection. Guys, I have bad news. In our lab back then, we were tracing sleep stages in real time, just seeing EEG, EOG, EMG, and so on. So we were tracing REM sleep with 100% accuracy, trying to sense all kind of stimuli, lights, vibrations, sounds, whatever. And it seems it's not the case. It's not. It's not about accuracy. It's not about signals. Even if you do it manually, even if you do it in the most proper moments, at the beginning of REM sleep, in the middle, there's something else. And my hope is that only machine learning will help us to figure out what's going on, because even if you do it perfectly, it does not work, even for the most advanced practitioners, lucid dreamers in the world. So that is why, Ken, I hope that you will find a way how to train your models to adjust signals. So I'm just trying to say that it's not just about signals. It's not just about REM sleep. There's something else. And it seems that human brain cannot figure out what to do with it. Our only hope is AI.
One quick thing on that point to just weave a little bit more into, it's like, we've constructed these sleep stages that are like really derived by humans, like the definitions. It doesn't mean like this is the absolute reality of what happens to the brain while we're sleeping, right? The physiology is much more complicated than that, but they fit into neat boxes of N1 sleep, N2, N3. Like for instance, there's different phases of REM or different types of REM, like tonic and phasic, and perhaps even more than that. So maybe it's like targeting a different subset of REM, or maybe it's something entirely different altogether that falls outside of the classic sleep stage classification. But it's like this sweet spot. It's like we don't know what the sweet spot is maybe effectively yet, but if we can find it, at least we increase the probability of inducing a lucid dream. But to be effective enough, maybe we don't even need that if the stimulation is thoughtfully rolled out, where we can kind of like ramp up the volume, as Dr. Ken is saying, where we can reduce the risk of waking them up. But even if it's not like pinpoint accuracy on the sweet spot of like when to time the stimulation, at least like we can have this kind of like imperfect range in which like the lucidity is more possible, and it doesn't have to be absolutely perfect, which is going to be difficult in consumer wearables in like a comfortable form factor.
I mean, if you could move the needle, sufficiently, that would make a big difference for lucid dreamers. Because, right now, for most of us, it's like infrequent and kind of hard. And regarding the incorporation rate, I mean, if you look at a lucid dreamer, the literature says the incorporation rate's 40% for external stimuli. All right. So first of all, it's not 100%, it's 40%. And I can say for sure for non-lucid dreamers, based on our studies, it's a lot lower than that. I mean, it might be 10% of the stimuli. Now, the nature of our tests is they're done in the home sleep environment. So the users are at home with their Apple Watch and they're just doing the thing. And we can look at their dream reports and we can tell from the hypnogram what stage they wake up from. And we can see that it played. Like if you look at our app, you can see when the stimuli played, and you can see when that hypnogram, the health kit basically said it was in REM sleep, and that gives you a measure of accuracy. So I'll just say that. And then the other thing I want to say is, yeah, Michael, like I agree with you. Like the way I think of it is there's these different gates, right? So the first gate is REM targeting. The second gate is Q intensity at the right level. And then the third gate is there may be some kind of micro targeting that is needed that would maybe if you could measure what the thalamus is doing. And I have different theories about when the incorporation might happen. So one idea I have is, the neurobiology of REM sleep is that there's these things called PGO waves, pontine geniculate occipital waves, which go from the brainstem to the thalamus to the occipital lobe. And the idea, at least according to activation synthesis and Alan Hobson, is that this gets the dream started, and then the dream kind of runs with the brain activation. But then every once in a while, you get these perturbations, these PGO waves coming up. And that's why dreams have this sort of structure where it goes along and then there's some whole perturbation which changes everything and then you just go with it. And so the idea is those are the PGO waves, but it's possible that when the PGO waves come up, because it's going through the thalamus, maybe that's a window where you could stimulate where the thalamus is somehow accessible. So it's just an idea. I mean, there's phasic, there's tonic, but I think you're right that there could be this micro targeting that if we had the right sensor in the right area, we would maybe be able to figure out those moments when people are when it's more open to the external world, when the sentinel is more open.
So can I give you just one interesting example, just to understand how problematic it is. In our laboratory, when I got stimulus, different kind of them, during REM sleep, I was able to become conscious while dreaming maybe just a couple of times. But when I was waking up from those signals, I was able to reduce REM sleep using specific actions. So, for example, if without any help, I can induce 2, 3, 4 lucid dreams a night, mostly using those moments of awakenings. But even those precise signals during REM sleep, manually tuned, didn't help. And for some people, it helps more. For example, I remember we had one participant, and in his case, it worked pretty often. Not all the time, but pretty often. But for many people, it didn't work at all. And for example, I'm one of them. If you try to help me to become conscious while dreaming, sending lights or whatever, it almost doesn't work, even though I know how to induce lucid dreams. So that's how insanely tricky this topic is. That is why we need to know what lucid dreaming is. We still don't know it. I mean, it's nature, and we need some innovative approaches. That is why the more people try different approaches, the better. Sooner or later, something will work out, and at least we will see some directions.
Right, and different techniques. You're talking about well, it's kind of a combination of finding the right neurocorrelates for lucid dreaming, but also stimulation techniques that are effective. Is that right?
I mean, that's once again, we have a very serious problem. We still don't know what lucid dreaming is in its actual nature. Have you seen one of the latest paper about microstates? Stephen LaBerge, one of the authors, it was published just 2 months ago. It's about microstates. They were looking at microstates. I was one of the reviewers of that paper, and they have used an interesting approach. They, instead of looking at specific sleep stages, they looked at micro states. It's a relatively new thing, and it helps to see a little bit more information from EEG output. And they have found some correlations, but maybe it's a right direction. It's not, but once again, we still don't know the most basic thing. What it is, how it happens. We can try many things, and after trying one of them, I have a hole in my head. It may work, by the way, but we need something else, some advanced techniques, some safe techniques and methods.
Yeah, I think maybe one. Well, yeah, actually, I'll plant a seed for a question. I'll let you go, Ken, in a minute here. But I'm thinking like it could be interesting to hear like more broadly from people on. It's more of like what is your kind of ideal lucid dreaming device, and just like hear from a few different people of like what do you kind of like conjure up in your mind of like a device that you would use on a nightly basis, more from like the user perspective, less from the builder's perspective. So we can kind of like inject the user perspective in with more of the builder perspective too. But I want to hear from, yeah, what you got to say, Dr. Ken, before that.
Yeah, well, the microstates is similar to like the idea of micro-targeting, that there could be windows when it's more open. And I also can relate to you, Michael, because with our participants, we had one participant and it just kind of worked for her. And, you know, she had, like, it just worked. Like the cues were incorporating. Whereas for myself, I mean, I'm the #1 tester. And I've liked like lots of different cues and on myself and woken up a million times, or like slept through it. And I find that I'm a more difficult candidate for this technology. And it's led me to really try and, you know, do better and try lots of different approaches. And I find that I'm very sensitive to, you know, like even the vibration on the watch can wake me up instantly. So I have to use the lowest vibration and spread it out, and then sometimes I'll get something. So anyway, there's individual difference, and some people who are a minority, unfortunately, it'd be great if it worked for most people, but there's a few people it just kind of works for. But for most people, like Michael says, it's like not really obvious. And then one other thing we tested was we have these different phases to the study, right? So one phase was testing different stimuli like light and watch vibration and sound and music and such. So that was one phase. Another phase was looking at dream ads. And I'll just mention, you know, dream ads are controversial, but the idea is you can take cues that are really well developed, right? Because they're developed by advertisers. So one of them we used like the McDonald's cue, and we had some people dream about McDonald's, right? So the idea that you play the appropriate cue and you can get dream content related to cue, that can for sure happen and did happen in our study. Not always, but it happened. And then the last part I want to mention is enhanced incubation. And there what I did is I had a movie of myself doing a bunch of state tests, like pushing like looking at my hands, pushing the hands to each other, holding my nose and breathing in. And the participants watched the video and followed along. And then we played the soundtrack to the video while they're dreaming. And one person did have, a few people, a minority, had dreams of the cues, right? So here's one. Last night I was starting to lucid dream because I counted 6 fingers on my hand. Then I counted again and I counted 7. And I kept on going until I got to 11 fingers on one hand. But at 8, the extra fingers were just nubs, not full-length fingers. I mean, this is classic like lucid dreaming stuff. So the enhanced incubation, it's about prepping, you know, it's trying to leverage incubation and actually increase the depth of encoding by having the user follow along and do the state tests. And then when you replay it, it does, for some people, some of the time, lead to lucid dreams. But again, it was like a minority. So, yeah.
Yeah. So yeah, hit or miss. Need for personalization. It seems like if you want to reach a broad audience, or at least like a tuning or kind of calibration phase.
Yeah. Yeah, maybe on the stimuli too that you're calibrating. So not only on the model, but also on the stimuli. The other thing is, well, what is lucid dreaming? I think part of it is that normally the prefrontal cortex is deactivated during dreaming. So we think the dream is real. So that's the normal state. And then the prefrontal cortex waking up is that kind of aha. So I think that's got to be part of it. And I think maybe, you know, people who lucid dream a lot, they complain of being tired. And in fact, a downside of lucid dreaming could be that maybe your prefrontal cortex needs that rest, and waking it up, you know, maybe, you know, to do it once in a while is not a problem. But people who like lucid dream all the time, they do report being tired. So
Yeah.
so there may be a line there.
Oh, for sure. Yeah. If like that part of the brain needs to rest or kind of do its own thing. I also heard something interesting from one of these rare people that have very frequent lucid dreams, like nightly lucid dreams. And he was saying that when he released some of the control he was exercising on the lucid dream, he felt it to be more refreshing in a way. So it's almost like the storyline had this kind of like more restorative effect relative to him imposing his will or desire for control over the lucid dream, which is kind of like an interesting thing to think about. So I think we dream for various reasons, and some of it which is to kind of like receive the programming and maybe associated emotional healing that comes with that. But like that was at least an anecdotal n=1 example of like, he's like, yeah, when I like release some control, it's like the lucid dreams got less exhausting the next day, which like, yeah, it's just kind of interesting if nothing else.
You know, with our app, you can set a window to play with your dreams, and normally you're going to set that in the last 3 hours of sleep. That works quite well, or the last 2 hours, but you want to protect that early sleep because it's disruptive, right?
Maybe this is a good, yeah, for sure. It's like not all REM stages are created equal, or at least like I find the richest dreams come in the later periods or like of the sleep period. And perhaps this is another reason for these devices to do more than one thing, to go beyond only inducing lucid dreams, to actually help people fall asleep faster, get deeper sleep. So I'd be curious to hear more from, either Michael or anybody from BIA if they're willing to share a bit about this idea of like starting with the foundational sleep quality improvement and then having lucid dreaming be a complementary feature on top of that. So I think they are like better together.
Hello. Yeah, thanks,
Hey,
Brian.
Andrew.
This is one of my first Tech for Dreaming events, so I appreciate it.
Good to have you here.
Yeah, so I'm Andrew, one of the team members at BIA, and yeah, so we're starting with sleep as the first stage. We 50% of the people in this world are having problems sleeping, and if they're having problems sleeping, they're probably not making it to a point where they can sit down and be a little bit more conscious about lucid dreaming. So our goal is to affect the sleep first and then work on the lucid dream states later. Yeah, we use fNIRS for our tracking. And perfect, thank you. And
their website link is at the bottom if anybody wants to browse through their website too.
Yeah, we're still in pre-order. We're launching orders in batches and should be kind of rolling out everyone's order by January. Fingers crossed. Hardware business, we're always things being thrown our way. Yeah, on the hardware, like waking people up, we use entrainment and neurofeedback to affect sleep states, and we do that throughout the entire night. So we don't really have an option to turn our music off. It just plays lightly in the background. So our idea from there is to hide the cues in there while your brain is already kind of activated and thinking about this music. Yeah. That being said, we're not too far on our lucid dream features yet. It's a sleep is really going to be our start. Lucid dreaming is a good stepping stone. I think like the dream for us is learning in your sleep, whether it's doing word pairing exercises or things in different languages to help you learn a new language or something different. But that's still pretty far in the future for us.
Nice. But I like how maybe this can be the sleep improvement can be a Trojan horse, so we can get a device out in the market and get another lucid dreaming device out there eventually. Because you're an actual lucid dreaming enthusiast, right? You actually are a regular lucid dreamer, is that right?
Yeah, I think I was much bigger into it in my 20s. I think I'm a little bit too stressed now in my 30s to go and do it. But
business.
Yeah. But that's why I'm going through this product and joining this community, and it's a future I've really been excited for.
Yeah, that's great. And just know that we'll be here to, if you have some prototypes of features along the way, or if you want to like share, early previews of what you're thinking about, I'm personally happy to give feedback, and I'm sure many people in this community are also happy to do that too.
Definitely. I'm going to be talking to a lot of you guys.
Yeah, sounds good. All right, let's go to Michael.
Yeah, I just wanted to make a comment that if you try to develop something for lucid dreaming and this market does not exist, it's much harder to develop something. So that's why Andrew is on the right track, trying to develop something for sleep enhancing, improving sleep, because if you manage this task, this goal, it's highly possible you will get resources to develop something related to lucid dreaming, because it's a much more difficult thing. It will take much more time, much more resources. You need at least something now to support your company, your team, and so that is exactly what we're doing as well, because we just understand that first we need to develop something that everybody understands, almost everybody may benefit from, and it may help us to support our expensive, very long-term goals regarding lucid dreaming.
Yeah, that makes sense. And probably some good data benefits too, if you have more devices on people and you're accumulating data, and especially if that data is like structured with tags, or if there's a way for people to say when they're lucid, or there's a way to learn, I think, by starting from that broader use case, to then figure out how your device could be used to induce lucid dreaming, like once you kind of get it out in the wild with more people using it. Yeah, Dr. Ken, go ahead.
Well, I guess I'm just looking at the BO website. Where are you guys located?
So I'm in Vancouver. Our team is remote across Canada, and then we have contractors from there. So a team of 12. We're hiring. We're going to have some new jobs on our website. We'll plug more on the engineering side, but yeah, Canadian.
I'll just mention I'm in Nova Scotia, so we're a Canadian company too. And then I'm wondering, so, well, a couple things. Is it binaural beats or is it something else?
Something else. We used to work with one of the co-founders of Brain FM, who has, I guess, recently passed away. So we're still building on his research, and we'll actually have patents for our music kind of coming up soon.
Yeah. I will say, one of the things we've been experimenting with is like light flashes at different frequencies that are biologically relevant, right? So the binaural beats, I mean, I would say it's not a slam dunk, if it's more than, suggestion, but there certainly is evidence, like with light or sound, that you can drive certain biologically relevant frequencies like the alphas and the thetas and stuff like that. And then I guess the fact that I'll also say hardware is hard. So I've got a prototype sleep mask and I've got a prototype rocking bed, which I think will actually help people sleep better. But suffice to say, like, hardware is like so much harder than software. Yeah, so I've just been kind of kicking along, but I'm impressed that you have the fNIRS or that you're working on getting that into that sort of form factor. And then I guess I'm curious, I mean, it's not EEG, you're looking at blood flow. So what area of the brain are you looking at, like the prefrontal blood flow?
Yes.
So I could see how that could maybe help you detect REM, in the sense that presumably the prefrontal blood flow goes down during REM. Do you have any EEG in it at all?
No, we made the decision to go contactless.
Do you have a PPG and an accelerometer?
Yes.
You do. Okay. Well, I can tell you that works for hypnograms. Yeah.
It's as close. Yeah.
Yeah. Yeah. So you've got, in a way, you've already got an Apple Watch on the head, and then you're adding fNIRS. And then the stimuli is the bone conduction audio.
Correct.
Is there any vibration that it can do?
Yep.
Yeah. Any light flash?
Yeah, so we have 4 LEDs. They're all addressable. And you can do any pattern you want throughout, or any really color. We haven't locked in a light pattern we'd use for lucid dreaming in. We're still kind of exploring that.
Nice. We have a good Canadian representation on the call today, coast to coast across Canada. This is great. Yeah, go ahead, Michael.
Just to mention that increased blood flow in the prefrontal cortex is associated with lucid dreaming. So just to understand that it potentially, indeed, it could be used for something like this.
Yeah.
If I'm not mistaken, Baird published it around 10 years ago, or maybe.
Oh, Benjamin Baird.
Benjamin Baird, yeah.
It'll be interesting with Muse coming out with their new headband. I guess it's already out, but it combines EEG and fNIRS too. So maybe there's like more data coming on these neurocorrelates of lucid dreaming, at least from what's addressable from the consumer, kind of form factor in a headband. And yeah, as mentioned, I think it'd be fun just to open it up too, if anybody wants to share a little bit about like broad strokes, what their ideal lucid dreaming device would look like from a user perspective, just to kind of like broaden the scope of the discussion here. Like, are people picturing a mask, a headband? Like, what would their expectations be around effectiveness? I don't know if anybody's willing to share what their kind of ideal lucid dreaming device would be.
I was actually going to mention, like, I'm wondering if someone has a contact to Brian Johnson, and not about his longevity stuff. He actually, people forget this, but he actually created what's it called, Kernel, which is like this, brain scanning device that's somewhere between, he was aiming for sort of a more portable, MRI type of a thing. But that it seems, as far as I can tell, maybe I'm misreading it, is that the data from that is just very interesting in terms of granularity and detail. And what could be interesting is to get him on board of running some scans of people in a lucid dreaming state. Now, I don't know if the headset is kind of like optimized for that. Maybe it's hard to fall asleep in. Maybe you can tilt people just a little or something. It's already looking a lot better and a lot smaller than the first version. But I keep going back to, and I think people mostly agree here, that the more we map about what's going on, right? The example that I think Michael gave about like, oh, there's increased blood flow, and what's happening in the prefrontal cortex and so on. The more data we can get about anything that's happening in the brain in the transition to lucidity and during lucid state, and comparing it to non-lucid states, the more information we can get, the more we'll have an in to, basically reverse engineering lucidity. So if people keep that in mind as you build your companies and get contacts and so on, this could be an interesting avenue to try to get Brian Johnson or somebody at this company on board with doing some research. They've done mostly, I think, psychedelics and other stuff, but sleep and lucid dreaming could be perfect for this.
Nice. That's a good call out. Makes me think of also, the prophetic team was working with the Dunders Institute around a study that had people with MRI safe EEGs and put them in a functional MRI machine to try to get a sense of, if there's any correlations between the EEG data and the fMRI data. Not sure if there's been results on that, but I liked that approach of like, let's gather more data and see what we learn, kind of thing.
Yeah, correlating existing data that we have would be great too.
Yeah, I think the key there is like then being able to measure in a consumer form factor, because you can't expect people to sleep in an MRI machine for it to work, obviously, but you can at least have that more comprehensive data set to then tease out the correlations that you can get from a consumer friendly wearable device. Any other thoughts on a consumer wearable friendly device that probably doesn't look like a football helmet without a face mask, which is what we're looking at here? Yeah, go ahead, Ken.
Well, again, the rocking bed is something that gives a new type of stimulus that we haven't tested a lot, which is vestibular stimuli. And so again, there's been challenges with building this automated bed, but it does have a Bluetooth, and so in principle we could connect it to our app. So I guess I'm interested in that, you know, and it's got then this really unique form factor because it's actually a bed, not you know, a mask or, you know, a headset. So but again, you know, then it gets to fundraising, because really fundraising is critical for us to like get there. Actually, I'm curious to ask people's opinion about price point. So for example, our app at the moment, it gives a 1 month free trial, and then the price point is $6.99 USD a month. And we've had a little bit of conversion, but not very much. And so now I'm considering dramatically lowering the monthly and also allowing maybe people to just buy it outright, because maybe people are tired of subscriptions. So, and again, this is for, at the moment, I would say the app is a support, but it's not guaranteed to give you a lucid dream. So it's like, well, you know, is $1.99 a month? Would that get me more conversions? It does work well as a dream journal, because you can just speak your dream into the watch and it does voice to text. And there's some AI integrations we could bring into it to, you know, enhance, you know, dream visualization and maybe dream, you know, dream signs, dream interpretation. But any thoughts on pricing?
Let's see. I'm gonna pass over to Allison in a minute, but I'll inject a few pricing thoughts and maybe offer what could be a pretty innovative approach, where I know in some meditation traditions, they have this sliding scale approach where it's not just a fixed price. So perhaps there could be a way to get at price sensitivity in a more, not automated way, but in a more kind of flexible way, where, like, you know, X amount of consumers might be willing to pay $2, where other ones might be willing to pay $6. And you probably build some brand, like some goodwill with the brand. If you're like saying you can pay as little as $0 to try it, to at least get a taste of it, assuming you don't have a whole lot of incremental costs to run, you know, like the software part of the business. And maybe that could give you an initial starting point to experiment with price in real world, you know, users, to then get a sense of the price sensitivity. And you could always go back to fix later. But
like, where it is at the moment is it's a freemium app. So you can basically, you know, use it for free to capture your dream reports and to use a bunch of pre-made scripts. But if you want to make custom scripts, then you pay for the subscription. And you could build out a bunch of custom scripts, like if you wanted your own voice, or if you had a movie, you know.
I would, like, my instincts, take it for what it's worth, would be like ungated, you get access to everything for a duration of time, and then it's like up to you and the team at DreamDirector to make it effective enough such that they continue using it. So it's kind of a nice way to align the incentives, where they get to experience the full set of features themselves and get a taste of how effective it could be, assuming you can get it to the point, you know, like where it is effective. Because I feel like a lot of people have this fatigue around, like, oh shit, they're hitting me with the paywall. I didn't even get a chance to try everything yet. I'm not sure if it's going to work. At least let me try the thing before, you know, like, to see if I benefit.
I mean, at the moment you can use it for a month. And the thing is that, you know, one issue is, of course, you need to do training. So it's like for 8 days, it's just training. So I'm thinking that, okay, maybe we wait once the training's done, then that would set the month. And I've got to see if we can do that in the App Store, right? Yeah,
that's a whole nother thing.
Yeah. So there's that. And again, I think, you know, as we continue to refine the tool, I mean, it is going to get better, but there are certain, you know, as Michael's pointed out, like challenges with getting to, you know, like the on demand, and maybe, you know, there's some other thing you need to add to get there.
I think there, maybe there's these kind of intermediate steps before we get to on demand would be my best guess at the moment. So let's that makes sense. Let's bounce over to, yeah, let's go in order. Over to Allison, and then Daniel, and then Dash.
Thanks, everybody. This has been really interesting. My name's Allison. I have been on maybe one in the past at the very beginning, but I haven't been on for quite a bit. I come from I would consider myself more of the prosumer. Like I would be the audience in which this stuff would go to first. I consider myself an advanced dreamer, an advanced lucid dreamer. I have so much data about all of my dreams in very minute detail. I have 29 dream journals that are sitting right next to me. I have so much. I used to work at Google. I come from a data-driven, I have a million flick buttons regarding various different dream-related things. So I come it from prosumer, not lab, but I have a lot of lab-related things. I will say, just on the subscription thing, that's not what I wanted to talk about, but I think one of the things as a prosumer in this space, it's really hard to convince someone like me to move a dream journal experience or even lucid dream activity to an app for privacy reasons, for longevity. If I commit to your app, Ken, how long is it going to last? Are you going to just stop supporting it someday? And so for that reason, like it could be free, it could be $100, and I would pay it, by the way, if it was really good. I still would never, ever do that. And that's just, and then, you know, for a prosumer side, there are a lot of people like me who will just have their system. It's so dialed. My system is so dialed. I'll try it and tell you, hey, this for the regular, I guess, non-dreamers. I call them non-dreamers, I guess. But people who are entry level into this space, it all depends on who we're talking about, who we're talking to. And so what I wanted to say in regards to that, really hearing this dialogue is, you know, I think Michael really hit it for me earlier when he said, you know, what is the nature? What is the form factor? What is the ish of lucid dreaming? And I think that that's one answer. And then getting people to do it often is another question. And we're conflating the two. We're saying we want a device that we need to figure out what is the substance of dreaming. And the same conversation we're saying, and everyone needs to figure it out and do it on demand or whatever. And I think they're two fundamentally different questions, because the practical reality of getting people to do something day to day, every day, not every day, depending, is so different than trying to figure out the micro states of dreaming so that we can eventually get to a point where you can get to an on-demand experience. So I really feel like this question of should we be taking commercial applications to market right now is kind of crazy, because it's like, to Michael's point, we don't quite know. We know, we don't know, we know. The fundamental nature of lucidity and why we are equipped as human beings with this magical ability. Like that question, I still don't understand. Like, why are we equipped with this magical ability? And how do we motivate other people to want to be curious, to start training, to then go to an on-demand experience? I think there's that motivation problem. You know, I'm deep in this stuff. And I tell my friend who cares about me so much, and they're like glazing over, bored AF, they don't care. And so we're having this situation of like us, me prosumer, you guys researchers, and the everyday person as the same profile-ish. I mean, you're not, but you kind of are. And so where is that sort of nodule of saying, well, let's create devices for the research? This is why, like Andrew, you know, focusing on sleep, that's important. People suck at sleep, they suck at dreaming, they suck at lucid dreaming, you know, like, so how do we need to be answering the commercial application of lucid dreaming yet? Or do we need to be focused really heavily in the spaces that you're already focused so that it can trickle down into a way that is accessible? And, you know, I don't know the answer to that. I think it's obvious when you say it out loud, but I think we've been talking about it together so closely that it just feels like it needs to be a little bit untethered, so that one way or the other needs to happen, in my opinion.
Yeah, that totally makes sense to me. And I feel like a lot of people don't know what they're missing out on if they haven't experienced it, which is most people. So it's almost like you need to jump to the end to that device that can produce it reliably to then, like have people get that aha moment for
Yeah,
themselves.
it is like
you know?
what is the place where we can bring people in a space? Like, I don't know. I think the more interesting idea is to bring people into, like, there's meditation rooms. Why isn't there like a dream lab down the street in San Francisco where I live? So I can go in there and be like, this is we created this very expensive on-demand lucid dreaming device. You can't buy it. It's not for your house, but it is for you to go in and experience it at this dream hotel for one night. You pay for that experience, but then you have it there, and then you leave with the tools you need to be able to do it. It's like having a meditative experience where you're saying, I'm a classic meditator, but I want to be, all the way down at the end, at the beginning. And maybe there's a way to have some transcendent experience in meditation without the practice. But we all know in this space that you need to practice to do it successfully long term, which I think is the hope. You don't want people just having a lucid dream and then be done with it. You want it to be something that's, I think the benefit is this emotional support for yourself and then being a better human in society. I don't know, that creativity training, whatever. There are lots of reasons, but I feel like the introduction could be the on-demand, but you still need the tools and training. Anyway.
Yeah. I think it probably ends up or starts as an early adopters, kind of like the classic adoption curve, where like you have the dream tech nerds, like people on this call that are like down or motivated already to try it. And then like as the devices get better, it progresses along that adoption curve. I sense it's going to be, something like that, starting at a small kind of audience that grows over time as the devices get better and better. And we should start a dream hotel in San Francisco. I'm in over by the Panhandle, so
we can grab Ken's rocking bed, because I think that's a hard sell for people to change their mattresses. So we'll bring your bed into the hotel.
Yeah, entering a partnership with 8 Sleep, maybe we'll figure it out.
Yeah, we'll do it.
I want to hop over to Daniel now. I think Allison.
Hi, can you hear me?
Yeah.
Nice. Hi. Yeah, thank you guys so much. This has been such a cool conversation. And I just wanted to chime in. I'm a PhD student in Ken Paller's lab at Northwestern University, studying lucid dreaming. So all of these topics are very much in line with my PhD, and I've done a bunch of studies with Karen Cockley on related topics. And part of my PhD is also doing like a big analysis of all of our data. So we have like over 100 signal verified lucid dreams in the lab, particularly with sensory cues during REM sleep. And so we're doing like these sorts of analyses, trying to understand, exactly what brain states are best suited to auditory incorporation, especially that prompts lucid dreaming and responsiveness. So just wanted to say that's totally something that we're working on actively in our data. And I'm also running a few other kind of related studies. So I'm currently doing a study on galantamine that Dash has also been helping a bit with. So we have been giving some of our expert lucid dreamers galantamine to sleep overnight in the lab with EEG, and we're comparing their brain activity on galantamine and off galantamine during lucid dreams and not lucid dreams. So also trying to get at, specific brain mechanisms that might be involved, and like, why is it that galantamine increases lucid dreaming? Like, that still remains a pretty open question. I would say there hasn't really been a lucid dreaming study with EEG and galantamine. There's only that study by Stephen and Ben showing that galantamine increases lucid dreaming. So I'm trying to understand that question better. And we're also doing some studies with Muse, like you mentioned. So we are giving people the Muse headbands to take home, and we have kind of similar to, it sounds like, Ken's app, like we have like automated TLR with REM detection. So that's kind of an ongoing study right now, building on Karen and Nathan's previous studies using the like at-home automated REM sleep queuing. So yeah, I don't have really findings to report at this point. I just wanted to say that like I'm totally in on all of these topics, and if anyone wants to talk more about our studies, I'm happy to connect.
Nice. Yeah, really glad you're here and continuing extending the work that Karen was doing there and the rest of the team. And yeah, it's something I like about this community too. It's not just lucid dreaming enthusiasts or tinkerers and builders. It's also the dream researchers, like you're building, but like in a different way, like the research, kind of evidence and doing the studies. So yeah, grateful that you're here and furthering the, what we understand, because I think probably over the next 5-ish years, we're going to learn a ton about this space. So it definitely feels like a a good way to point your PhD from my biased perspective as a person that hosts this event. Yeah. Cool. I'm gonna hop over to Laura if you still want to mention anything.
Yeah, can you hear me?
Yeah. Great.
I agree with a lot of what Allison said about how we're the early adopters of this kind of tech. A lot of people either they don't know lucid dreaming exists, they don't know the benefits of it. I've read these articles by journalists looking into lucid dreaming, and then sometimes they end with, "Why would you want to lucid dream?" And I'm like, "Why wouldn't you want to?" It's like you don't get it because you're not part of the community. And I don't want to sound elitist, but it's like we need to convince people that this is worthy tech of investing into, just like they've done with like computers and smartphones and all that sort of thing.
Yeah,
and I really appreciate what Ken was saying about his smartwatch app, because again, that's tech that people have already invested into. They already have smartwatches, so it's something they just need to download and pay for, as opposed to buying something new. They're like, and they may not have trained to lucid dream yet. They may not think it, and that's why I think a lot of the previous tech has flopped, because it's like we don't have enough people in the community that believe in this stuff. I don't mean not believe in lucid dreaming. I mean like believe that it's worth developing tech for.
Yeah, no, for sure. There's like kind of an educational awareness job to be done here, as far as like explaining why somebody want to do this, and even educating people it's kind of possible, and it's not just something in a movie called Inception. It's like a real thing, and the benefits are real. And I do think I know I'm being repetitive when I say I think there's these kind of like near-term steps that don't get us all the way there, but help progress us, on that path to on-demand lucid dreaming. And I'm thinking of, like Dr. Kenny working with the Apple Watch, and we know it's imperfect for sleep stage classification because it's downstream peripheral artery sampling for like what is inherently a brain activity, although it's also a cardiovascular activity, I would argue. But there is, I think using the off-the-shelf devices can probably be good enough. And I think even a pure mobile app could at least advance the field if people are willing to tolerate, some, like sleep quality disruptions, if it wakes them up, if you don't have any on-body device. That's where some of these pure mobile apps can at least operationalize things like that targeted lucidity reactivation, and just make it easier, and do things like a voice-to-text transcription for a dream journal to help with dream recall. So it's kind of like making those cognitive techniques easier through the use of technology with the pure mobile app, where you don't even have to wear anything on your body if you don't want to, which again, I don't think that's going to get us on-demand lucid dreaming, but at least advances the field as kind of this like stair-step progression along the way. We will see. I'll go back to Ellison and then over to Ken after that. You're on mute.
I'm on mute. Oh man. Brian, you just said what I was going to say, but I want to touch on it a little bit more, which is the sort of like stepping stone of like, what are the little technologies that we can bring in smaller ways before we're starting to put a helmet on people, from a day-to-day perspective. And, we are sort of talking about the flick button as a micro technology, I'll call it. The flick button, if you don't know, it's a little Bluetooth button. It's very small. It looks like this. I have a sticker on it, but you can program it to kind of do anything. And this one, I have several, but this one in particular is a reality checking button. So I carry it in my pocket because it's a physical like object. I am training myself to notice more, because I'm going to push it and it's going to record the time that I saw an anomaly in the world. Big, small. I saw a shiny red truck today. I am terrible at reality checking. I think it's annoying, but it is one of those cognitive things that are so necessary, but aided by technology. And I've only been using this for 2 weeks. I just created it, and I've already had 5 lucid dreams. So I'm convinced that there's some little technology that helps push us in the right direction. That doesn't have to mean day one you have a lucid dream. There could be little gradual steps, and things like this are really supporting that. And because it's physical, like I've tried the remind you when you get, you have a timer on your watch that says, do a reality check. Don't like that, didn't like that. But the physical object of being like, I'm going to press this button and it is going to record on a spreadsheet what time that I had that experience. And then if I double click it, I confirmed to my spreadsheet that I've done a reality check with it. So I do a, whatever. I have 2 confirming moments that say, yes, I've done this today. Great, thank you. And so I track that throughout the day. And I did 0 reality checking before. I do it constantly now because I have something that says, oh yeah, I want to do that. And then I have some perspective memory built in. So every time I start the day and pick up the button, I also press it. Be like, well, might as well check right now because I have this little thing. And so I think there is an opportunity for, people like us to start thinking about smaller applications of and that's why, the app that Ken is working on and using the technology that you already have with you. I mean, this is asking more of people and it's too much for a non-prosumer. But, I think there is other ways to use what is around us to be smaller before going to the end of the prize, which is no thinking, have a lucid dream tonight. And, I'm on Reddit, lucid dreaming, and my gosh, is that community all over the place in terms of what they're saying. And I'm like, do you guys need to do this right now? I want them to have some training. They're like, day 1. Let's do it. And I'm like, do I want you guys to have day 1 lucid dreams? I don't know, like have some restraint. But anyway, yeah, the progress towards small things to bigger things feels like a better or a more attainable leap in smaller stages.
Nice. Yeah, that totally makes sense. The stir step approach. And I like having something physical too. It's kind of like this totem kind of feel in a way, which not everybody's going to be motivated enough to carry it around in their pocket, but it's an easier ask than wearing the big giant helmet as you're falling asleep. And yeah, like that's the reason I get lucid a lot. Just like share a little bit about my technique. Like I'll do a reality check and then I'll levitate. And like my levitating in a dream is like my confirmation that I'm lucid. Like that's my repeatable thing I can do. So I can totally imagine like doing the double click to then after I do like the levitation try. And I blame Jay for the subreddit lucid dreaming moderation because he's a moderator over on that subreddit.
I'm sorry, no offense.
No, I'm with you. That place is crazy. I barely can keep it contained.
Yeah, exploding with enthusiasm. Well, there's hundreds of thousands of people on that subreddit, right? It's pretty popular.
No, it's gotten out of control. We're trying to add more moderators. I've been sick. It's just been chaos, but we're working on it. Stay tuned.
Yeah, it looks like 80,000 weekly visitors. I'm just looking at it on my other screen. Yeah, so let's bounce back over to Ken. I see his hands up.
Anyone from the subreddit that came here to watch this video, no offense, you guys are lovely. Just gonna throw out that warning because I'm gonna get yelled at.
Yeah, that's kind of like the fun of Reddit. It's got some fun chaos here and there.
It's great to hear from you, Allison. Like, it's really such a valuable perspective for me to hear from you as a prosumer. And I love, that you're using the manual button. When you think back to the Nova Dreamer, one of the best features was there was a button on it that you could press and it flashed a light. And so it had a built-in state test. And dreamers would sometimes click the button in the dream and no light would come on, right? So I guess my question with you, Allison, is, your thing is logging that you did a state test. And what is your state test? Like you're putting your hands to each other or something?
My state test that I do regularly is to pull my finger, yank it, and anytime reliably in a dream, it'll just stretch out into nothing.
It'll just stretch, yeah.
It'll just go, and it's.
Yeah.
If I can also do that, I'm doing this daily in my life. I don't want people being like, "What's happening?" And it's pretty subtle. I can just do it, and no one's watching me. So yeah, that's.
I mean, mine is pushing my hands to each other, but
yeah.
I guess my point is that, like, with my goal with DreamDirector is to make the best kind of consumer lucid dreaming, app that can be made with the technology. And so this is functionality I want to add, so to add, during the day, you could wear it. It could say, "Are you dreaming?" And then, like you said, the best would be if you could push a button on the watch, and it would flash a light or give you something, and you'd be like, nope, okay, and incorporate it in. I mean, one challenge, of course, is then you have to wear the watch around. And then the other part is then you need to really charge it before you go to bed, right? So the way I mostly use it is I just use it for bed. But that is such a great technique. And state testing is effective, right? I mean, it's one of the more effective
annoyingly
techniques,
so, because I find it to be one of the things that's difficult for me is this. There's two parts to state testing, in my opinion. And the first part is you can state test. I can do it right now and be like, oh, this is a dream, and do a state test. Or I can be triggered by something unusual in my environment and say, oh, that's going to be the reason that I do a state test. And I find I got very frustrated early on in my dreaming experience because, I'd see all kinds of, obviously we see all kinds of crazy things and they all seem absolutely normal. And I was never really carrying a reality test without an accompanying dream sign into the space. So doing a reality test of the "Are you dreaming?" on my watch telling me wasn't actually working for me because I wasn't tying it to noticing something is strange. And so, if we talk about perspective memory, which I also think is important, this is why I do it. I do a reality test when I pick up the button, but I'm not doing reality tests and triggering the button unless I'm noticing something strange. And funny enough, 2 nights ago, I was dreaming and I was on a train that was moving really fast. I didn't notice anything strange, but then I didn't have my purse on me. And I thought, oh, no, this is unusual. I would always have my purse. I have my bag. Why is my bag not here? And I was like, oh, I'm going to push my button. I don't have my button. I don't have anything. I'm definitely in a dream now. And so it did and I thought, okay, I would never have noticed me not having my bag on a train without doing a little bit of work and training in a space of noticing things in an unusual way, which has been really focused for the last 2 weeks. So it's the dual modality. It's not just, okay, I got a watch notification that says it's time to do a reality test. It's combined with the noticing of that. That has been effective with the button.
Yeah, that makes sense. And to be a bit repetitive from earlier, I do think any kind of technology is much better paired with the pure cognitive, techniques of doing the dream checks with or without the flick button, which I need to look into these buttons that you and Dash are talking about in the chat. Because I
oh, Dash, you do the same thing as me? That's amazing. I love it.
Yeah, I use another use of technology I use is using the voice memo on my Apple Watch if I just roll over, because you tend to forget your dream memories even if you move around a little bit, and I find that to be helpful to at least have kind of like the signposts of what happened in the dream, and then I can fill in the details later. Usually I put it in a Google Doc when I'm able and willing to do it.
Here is my most lo-fi amazing piece of technology that I just got a week ago. I've been really up on this, is this thing. Oh, I should do it this way. This. See this? This is my lo-fi technology. This is a stencil so that when I'm writing in the dark, I can hit the bottoms and the tops of my stencil so I can write in the dark in a very legible way. It's incredible. This lo-fi tech works.
Yeah, there's also some pens that have LED lights built into the tip.
Yes,
they're
still can't write straight and it not legibly. My dream notes, this is how I do dream journal, is this. So I have awful night writing, but not anymore because I have this little stencil.
So I will
Lo-fi
say with DreamDirector, you can capture voice to text, and there is an option to just export all your dream reports to an Excel file, or you can just export it to a file. So there would be ways to, integrate it with, the Google Doc, or one of the things I was eventually interested in is, could you publish it as a dream journal? Because I get it. I like, my dream journals too. You open them up and you flip through and you kind of Although that said, often they're scrawled in a way it's kind of like, what was this about? But anyway.
You can publish a dream journal. It's really nice via lots of different tools that made this. But yeah, this is what all my dream journals look like. And I have 30 of them.
So is it, and they're typed. So how did you get that?
I wish I
did you
could
say?
show you my the version of all of them on my desk. It is a lot of technology actually that I use to do this.
Yeah.
I have a spreadsheet, and then I have a plugin on my spreadsheet that will translate what I have told it to take out of the spreadsheet, and it'll put it into a Pages doc, and then that gets transferred into the PDF. But I've decided to tell the app plugin that I use what to pull and then how to format it into a book format.
Yeah.
And then I use Keyboard Maestro, which is like a little applet that helps me do a lot of different things to format. And so, yeah, I'm a tinkerer, but not a researcher. I have a lot of tools that help me do a lot of things to output these 30 dream journals that I have on my desk right now. But yeah, one of these is one quarter of dreams. So it's 8 years or 9 years of all of these in here. So yeah.
Wow.
Technology in a different way. Yeah, I like using technology to augment what I'm doing as opposed to like use it as the thing to get me lucid, I guess.
Yeah, it's nice using technology to like kind of make it more old timey and analog in a way too. It's kind of
I use
delightful
technology.
twist.
Well, actually, this is another thing that I did, and you could be I'm not going to talk about being pro or anti AI, but there are a lot of tools that I used via AI. This is a compilation of dream research over. These studies are 1893 to 2009, but it basically summarizes all the research I could find, and then I create my little at-home research labs based on the research that because I cannot read thousands and thousands of research papers.
Yeah.
So I have them summarized and then turned into these research compilations that then I study and then develop ideas for how I want to bring that into my at-home lab. So lots of tech, but not in the way that we're talking about.
Allison, where are you located? Where do you live?
I'm in San Francisco.
You're in San Francisco. Wow. Yeah.
It's a good place to get the reality check, triggers. If you're,
I live in San Francisco. There's a lot of really weird dreamlike stuff around. It's great.
Yeah, good place for dream checks. I like it here too. I know we got about 15 minutes left in the scheduled time. I can stay longer than like 15 minutes, but I do want to like offer up like maybe a menu of final topics that we could talk about. Like some things on my mind is if anybody wanted to talk about any of these kind of upcoming devices a bit more, like we could talk about prophetic. I don't know a ton other than what's on their Twitter account. So that's one topic because we haven't talked that much about targeted focus ultrasound yet and prophetic. Great that Michael's here to talk about REMspace. We could talk a bit more about that, I'm sure. There's this 40 hertz thing that keeps coming up in the device stimulation space. I was just revisiting the VOS 2014 study. So it could be kind of fun to talk about like 40 hertz. Does it make sense? Does it not make sense? That's like an open topic we could talk about. Or just kind of more freeform. If there's anything else, like somebody wants to talk about that we haven't talked about yet, I'm totally open to that too. So I see Michael's hand up, so we'll go to him first.
Yeah, it's just interesting to share our opinions about this 40 hertz thing, because I don't remember last year or when Stephen LaBerge had published a paper showing that it was just artifacts from EOG, and it is exactly what I saw when I just learned how to use polysomnography devices in our laboratory. The first my lucid dream, when I induced it in the lab, I just sliced it to see what's going on in different frequencies, and I saw some spikes around EMG frequencies, which are around 20 to 70 hertz when I became conscious in a dream. But I saw those spikes exactly when I moved my eyes to show that I was conscious. And that is exactly what's, but I thought back then, I thought I was stupid, because what are the odds that you use a polysomnography device for the first time? And I thought I was just mistaken. Some smart guys knew it better than me. And in our laboratory, we haven't seen anything related to 40 hertz at all. We see artifacts from eye movements. The same was confirmed by a few other researchers. And in our data, we didn't see anything about it. Maybe Daniel will share his opinion about this. It would be interesting to know what's going on in their lab regarding this particular topic.
Of the 40 hertz eye artifact?
No, it's not about specifically 40 hertz. It could be, but it's in the range of EMG frequency. It could be lower or higher, but it happens when you move your eyes to confirm that you are conscious. And it's not a coincidence that your eyes are close to the prefrontal lobe. So artifacts, obviously, you can see artifacts easily there. So I'm just curious what other people think about it.
Yeah, I mean, I think that paper from Ben and Stephen is great because they talk about different processing pipelines. You know, they talk about the strengths of using ICA or other filtering methods when it comes to processing EEG data. So kind of depending on the number of channels that you have in your data, you should be doing a certain amount of processing. So I thought theirs was a great paper and did a good job of kind of addressing where that 40 hertz artifact was coming from. So personally, I don't have much criticism of their paper.
But by the way, in your lab, do you see any correlations between lucid dreaming and 40 hertz frequency in the prefrontal lobe? Or did you try to check it out?
I have not seen that in our data, but I suppose that's because in our analyses, we've been trying to follow this processing pipeline. And so after doing that removal of eye movement saccades, like I have not seen that pattern, but we're still doing our analyses. So I don't want to kind of make any sort of preemptive claims of whether there will or will not be some high frequency activity differences. So yeah, sorry, I don't have the full answer.
Yeah, but it's a little bit, actually it's a huge thing, because there are so many startups or ideas based on that exact paper about 40 hertz. And that's what concerns me, because it's a very, very unique situation. Let's call it this way.
I guess
I was revisiting this earlier today, so I could share a little bit about at least my understanding of that paper and how it was kind of misrepresented. I can give kind of the high level summary version of it, because I think it's interesting. There's definitely headlines that came out of it, promoting this success rate of 58% with 25 hertz and then 77% with 40 hertz. But then when you actually dig into the research methodology, there's this questionnaire, the lucid scale, that they used, where there's a variety of questions and you rate it 0 to 5 on that scale. And the prospective goal of the study in 2014 was to get 2 standard deviations above the sham, like above the control for that. And they successfully got above 2 standard deviations for the factors that mattered most for lucidity, one of them being this kind of factor of insight, awareness that one is currently dreaming. So they hit the goal of getting 2 standard deviations above the sham, but the actual amount was relatively low. When you look at the 40 hertz, it's around like 0.06. When you actually go back to the scale, the 0.06 is somewhere between strongly disagree, whatever is adjacent to it. So they're actually rating for insight that they strongly disagree, that they were aware that they were dreaming, but it was still 2 standard deviations better than sham. So they hit their goal. But when you actually look at the mean value of 0.06, that's relatively low on this 5-point scale here. And maybe some selective shrinking of the y-axis here. When you look at it here, it's less impressive. When you look at the strongly agree being a 5, strongly disagree being a 0. Again, statistically significant difference, 2 standard deviations, but it's all really low on the insight scale here. And I guess one last thing to mention here, they actually did a validation of this lucid scale in 2013, and they saw for people that had a lucid dream, and for the insight factor, they were more like 3.2 or 3.5 on that scale, people that had a lucid dream. So if you compare that to the 0.6, you can see like these people weren't actually hitting like the lucid dream mark that was validated in the 2013 study. Like another way to look at it would be, well, I got to show, I think you could leave meme patterns are so complicated. Try to demystify it by, like putting in like, this is what, like for the insight scale, like what it would look like on that chart that I was showing before the 2014 study. So anyways, I think that helped for me to like kind of clarify, like when you actually look into the data of that study, like it seems impressive on the surface, like, yeah, 2 standard deviations greater, but still pretty low on that 5-point scale.
I wanted to just say something about like when you're talking about brain waves and stimuli. One thing I've noticed is when I use light flashes, I've been experimenting with all sorts of frequencies and patterns and everything, and I find the lower frequencies tend to wake me up, whereas higher frequencies that are more like a flutter tend to not wake me up. Although I'll notice when the flutter stops, for example, and even when the flutter stops, it might wake me up. And then isn't that headset, the Be Asleep mask, isn't that about using stimuli to somehow drive brain waves? Is that part of what it's about?
I'm not totally sure personally how they're achieving that.
I mean, it sounds like they've got some kind of, well, they call it neurofeedback and neural soundscapes. So
Yeah, I have, this is from the website here.
did we lose?
Yeah, Andrew's not on anymore, so we don't have any
okay.
via representation anymore, unfortunately. So that the experts have left the chat on that specific question. But
Well, I guess my point is there might be ways to use sound or light to try and stimulate biologically relevant brain waves that could maybe move the needle. That's, an idea. Yeah, that's all I got to say.
I know there's other headbands, like I know this is a mask, but there's a headband Elamine too, where they say that they're measuring these brain waves in real time and then applying noise or sounds to then dampen the oscillation of the brain waves, or like make the waves slower to help people fall asleep, or kind of like nudge the brainwave activity to like get into theta faster by like measuring what's happening in the brain and then applying sound.
So that's neurofeedback.
Right.
Maybe.
I'm not saying that's what BIA is doing, but that's my understanding of what Elamind is doing with similar technology, although they're using EEG instead of fNIRS. Yeah, go ahead, Michael.
Yeah, I just may comment it a little bit. when we talk about technology like this, we should understand that when we try to influence what's going on in our brain when we are asleep, we should always remember about simple things like, for example, if your cat or dog is asleep, and when a sudden noise happens or whatever, it reacts. But if the same stimuli continues, your dog, your cat, or you yourself eventually won't react to it, and your brain will try to adjust how it perceives external stimuli and may sleep deeper, for example. And it's one of the ways how different gadgets or technology may try to help people sleep deeper. And partially, it could be the case in this situation. You just by stimulating a sleeping person more, you may achieve deeper sleep. So just my comments. I don't know how exactly they do it.
Right, which almost sounds like, if I'm understanding right, almost like a white noise kind of effect where there's less, like the cat noise kind of fades into the background.
Yeah, habituation. Habituation. It's called habituation. Yeah.
Right, that makes sense. Yeah, that's a good point. So we got, what, 3 minutes left in the scheduled time. Again, I can go a bit over, but anybody have any other topics they want to bring up with kind of the remaining time here? Any hot topics floating around out there?
I'm impressed by the Ellison's dedication, because I have never seen so many dreams have written. It could be maybe the most detailed dream journal in the world, and it could be.
I'm scared to show you my spreadsheet. It's insane.
Yeah, and
I feel like a crazy person. I love it.
And I'm just trying to say that I'm pretty sure you are doing this, or you are thinking about it, just to try to feed this data to AI. And I'm pretty sure there's so many interesting things, and I'm impressed. I have never seen anything like this.
I'm in the process of moving, not moving, it's not a whole migration, but I have a lot of it now in Airtable, which is giving me a lot of interesting ways to connect it in ways that my spreadsheet doesn't do. And I'm not finished with it because it's taking a lot of, data is data. So there's a lot of normalizing that I need to clean up a little bit, garbage in, garbage out, but it's mostly very good data. So it's not a ton of cleanup, but it takes time. And I'm really excited to some early connections of things are so fascinating. Yeah, I haven't looked at it in a couple months, so I'm like really loose on what those things are at the moment, but I had to take a break because it was a lot of work. So yeah, thank you. I am weirdly very deep and dedicated to this work. So.
It's great. You also have the spreadsheet component to that too, as far as like the ability to search different themes or like feed it into AI or whatever kind of processing you want to do. So it's not all about the paper. It's like you get this digital structured.
Yeah, exactly. And I think that, I've been using the same spreadsheet with various degrees of upgrading a little bit for 8 years now, or 9 years now. And I would have built it a little differently from there, but it's all the same. It's pretty much all the same stuff. So there's a lot, and I think I have 95 different things I'm tracking, including daytime things that happen at night, not only just the dream itself, but the stuff that surrounds it too. It's crazy. I get that, but I don't know. I'm deep in it. I love it.
Yeah, crazy cool. And I think it gets even one more like point on this, and then we'll pass it to Ken. Like, I think cool to have it for one person, but then imagine having this for many people broadly, and the things that we could discover.
You know, I've
Um,
talked to I've talked to several
Really
people
update.
about this particular issue of like, you know, I'm rounding around 9,000 in my collection at the moment, but it's like, is it it feels like really interesting to have one person's 9,000
Mhm.
catalog. And how is that different than 9,000 people in one dream? You know, I obviously the more people, the better, but I also have a really interesting and unique data set
Yes.
that's different than the more people, different types of dreams. I've talked to a ton of
Yeah.
people. I've learned a lot about the different ways that people dream in very different ways, in ways that I don't dream. So it's just really fascinating to sort of see how the data compares, both as one person with 9,000 and growing and one person with 100. But yeah, it's a hard challenge.
I'm going to get a little woo-woo too, where like imagine dreams potentially being a portal into understanding the nature of reality and consciousness. When you have all these dreams across all these people, you can at least start to poke at things like precognitive dreams. Like if all of a sudden there's a spike in volcanoes in people's dreams, and then a volcano actually erupts a few days later, and perhaps it's kind of like located where the people are having the dreams. I'm not saying that's going to happen, but like those are the kind of topics that I'm like interested and curious for people to explore. It becomes possible when you have this data set that's well structured. I think there's been like plenty of anecdotal examples of that, of like plane crashes, people dreaming about plane crashes or volcanoes, and at least in like the mythology, or like, you know, I've heard anecdotally people expressing that that's a thing. So it'd be very like super interesting to get actual like data that's captured, and then we could compare, you know, like what their dream reports were to what happened, and see if there's, you know, like something out of the bounds of like what is statistically, you know, like you know, like reasonable to expect. Yeah, so let's go to Ken and then Michael.
Yeah, I guess I wanted to say, if you go to the Discord channel, of course, we've got our different projects listed, and I'll just mention that, you know, I had there a conversation with Helmut, and he had a request that we add external triggering so that you could trigger a device, so not just dream scripts and trigger things on the phone. So we have added that, and he's been testing it. And so, Allison, I could also see how we could, with our dream journaling, at the moment, you can just export the whole thing, but there could be an integration where we could, you know, it builds the dream journal, but it could also send it to your spreadsheet. And I'll also say the dreams stay on your phone unless you opt into research. There's an opt into research where our participants do, and then we're now seeing their dreams. But I guess my point is there would be ways to solve the privacy issues, but also maybe enhance your flow so that you could use the voice to text and you could see the hypnogram, and that it would work, it would enhance so what you're doing. So my point is, you know, if all of you, if you have requests for the app, go to the project DreamDirector in the Discord, and you can just, and I'll get alerts when that happens. And we have our own Discord, but I do notice there, and I do respond and try and incorporate those things. So yeah.
I will just jump in to say quickly, I think for me, anything that removed some of the manualness of my labor, a lot of my data is very manual. I mean, it takes me about an hour to 2 hours a day, depending on how many dreams I've had and how vivid and long they are, to update my spreadsheet. That's insane. No one's going to do that. So the more I can take off some of that load in terms of what's automated and things like that, the button really helps with me with that. And I also have another button that's by my bedside that anytime I have an awakening, I press it instead of, I used to write it down, but it was half groggy, couldn't read it. So I just press the button anytime I wake up. So I know, and it records the time. So I know when I had awakenings, and I double press it if I had a dream, you know, I know, and then I know when everything happened without relying on what I, you know, Health Kit's hypnogram, which I think is not very accurate. But I'm not wearing devices. It's just listening. So that's the worst case scenario.
Oh, okay.
So yeah.
I will say we have measured the Apple Health Kit against the Cerebra home polysomnography, and the Apple Health Kit, you know, this was maybe a year or two ago, but it was pretty accurate. It was pretty good. So
yeah.
I mean, it's not EEG, but it can
Yeah.
tell when you've awakened, and yeah, and you can see the REM periods, and with our
Yes.
app, you can see when you woke up, when you recorded a dream report, and when we played a cue.
Well, now that I have my button and the apps going at once, I can see if they match up because I'm physically saying I'm awake. I'm pressing a button, and the app is it tracking that time? And they're pretty good. They're pretty close actually. So, but the button is near the phone, so I'm wondering if it's hearing me press the button. I don't know. In any case,
but I'll also say that having a watch
Directional.
is better than no watch. Like earlier, Brian, you were like, oh, I mean, maybe you could have the standoff and a good look at your eyes or something, or listen to your breathing. I mean, there are cues, but at the moment we've invested in the Apple Watch because it does allow way better targeting than no sensors,
100%.
Yeah, makes sense. Let's go over to Michael.
Yeah, I just wanted to thank you for organizing everything. I have to go. It was very nice to talk to you guys. I have heard many interesting things, and I hope to see you in the future. Brian, thank you for organizing everything. So see you guys. I have to go. Sorry.
Yeah, thank you so much for joining and sharing about REMspace and where things are going. And yeah, we'll track the progress with Lucid Me Pro and everything else that you're creating over there. And fun discussion. Thanks for joining.
Thank you. Thank you. Bye.
Bye. Any other burning topics before we disband? I think I'm getting close to ready to wrap it, but I want to leave space for anything else that anybody wants to mention. Dash, do you have the Dream Phone still?
Yeah, it's kind of in the same place it was when I last talked to you on the last meeting.
Yeah, she was working on her homegrown lucid dreaming induction and kind of setup, which our first event in 2021, it was a tag team between her and Karen Konkley giving some presentations back when the two-way communication and lucid dreaming stuff was kind of fresh out of Pollar's lab. So that's how we started this, and awesome to continue it like more than 5 years later. And yeah, let's keep it going. I like getting this crew together. It's always a fun discussion, and this was a lot of fun. And thank you everybody for joining. And I think we could use some ukulele on the way out. I think Dr. kind of saw you holding that a few seconds ago. So you can bless us with some outro music. Maybe it's like a good lucidity cue.
I was about to say I've got to press my button because this is weird.
Yeah, everybody look, it's a good time for a reality check. All right. Thanks everybody. Have a good night.
Okay, take care all.
Bye,
Yeah, good job.
thank you.
Okay, bye.